you're here today to join the second part of My Major, My Career. And we are going to tag team tonight's presentation. John and Haley and I will be splitting up the slides. Katie's going to kind of manage the chat. So always feel free to put any questions you have in the chat and we'll address those. And tonight's will be recorded, so we will put it up. Haley will put it on this. Haley, where do you put it? I'm sorry.
When I record it, I'm going to I'll upload it to YouTube, and we'll send out a link, and also with the slides as well. So the slides will be included.
Great. Well, thank you. So we'll get started with today's agenda, and then we'll get into introductions. So the first thing we're going to do is do introductions. We're going to talk about HUS 223, which is the Field Placement Preparation course. We are going to talk about HUS 270, which is Field Placement 1, and Field Placement 2, which is 470. We are going to do talk about credit of prior learning. And we're going to do sort of a variety, talk about a variety of entrance points into this human services career. And we're going to talk about career progression as you advance your skills and moving forward. So we're going to start by introductions. And I'm Kim Lane, and I teach in the mental health and human services field. I am also the coordinator of field placement, so I tend to teach HUS 223. So I will pass it on to John. Do you mind introducing yourself?
No, not at all. Good evening, everyone. My name is John McLaughlin. I'm a student services coordinator. That's kind of a professional academic advisor role. And I'm also the mental health and human services program guide. And in that role, I help students with their placement information forms, information about placements, and kind of helping them get started with that process and up and running into the placement experience. Yeah.
Haley.
Oh, and Haley.
Yeah, thank you.
Hi, everybody. My name is Haley Brown, and I'm also a student services coordinator for UMA. And I also coordinate the credit for prior learning process. So I'll be covering that. And I also coordinate career services on campus. So if folks are looking for advice on conducting a job search, or I'll be talking more about the internship search later in this presentation. But basically anything career related, come find me. I can definitely help. And I think I'm going to pass it off to Katie.
Hi, everyone. My name is Katie Ebert. I'm the Student Services Coordinator at a Rockland Center. And Haley and I are kind of the co-creators of these series, collaborating with our faculty. Just want to thank everybody for joining us tonight. And then if you have any questions, please feel free to drop them in the chat. As we move along with the program, we'll try and be answering those questions in real time as it applies to the slide in front of you, but we'll also have some reserved time for questions and answers at the end of this session as well, if we weren't able to cover all of the information that you were hoping for the evening. And then if you need to circle back around with us, please just let us know. Feel free to drop your information in the chat if you would like us to connect with you after this session is over. I will pass it. Is that everybody actually?
I think we should include Wendy.
Wendy, yes. Pass it off to Wendy.
Hi, everybody. I'm Wendy St. Pierre. I am the academic coordinator for the Mental Health and Human Services program. So here to support all of my colleagues and helping to make sure that we can support you through our field placement and career search process.
Thanks, everybody. So as you can tell, this is a team approach, and so is field placement, and so is human services. So let's just talk about some of the prerequisites for field placement, the field placement prep course. So start with HUS 101, which is the introduction to human services. Usually it's something people tend to have the first semester. As well as HUS 125, which is the introduction to substance use disorders. And then we move to HUS 212, case management, and HUS 218, community mental health. and HUS 230, which is the interviewing skills for human services. So those are the prerequisites for 223. There are, and those are also the prerequisites for 270. However, we do strongly encourage you to take HUS 316, which is the ethics course, because ethics is a big part of our practice, and it's good to have that foundation. Next slide, Haley, please. So HUS 223, the main purpose of this is to get you ready for field placement, excuse me, and to start you getting, not only get ready for field placement, but to also start your professional exploration. Now, probably half or slightly more than half already have experience in the field. Haley will talk more about that. But this field placement course is also, not only is it about exploring your career, but it's also about how to set up placements. Because if you have experience in the field, which Haley will cover, which will cover 270, 470 is a requirement. So what are the two sections? So Haley, next slide, please. So HUS 223 prepares students for field placement 270, which is field placement 1, which is 112 hours, which equals 8 hours a week. It does not have to be in one day. It can be in 2 days. It's depending on you and the place of that you're going to do your internship. It depends on how you guys work out your schedule. UMA does not work that out. You as the student works it out with the placement. This is an entry-level experience course. So it's for people that have no experience in human services. Also, it's an opportunity to try different areas that you might be interested in. Like I've had some people say, I want to work with kids, so they get to try working with children. And then they forget that children come with families. So maybe they don't want to work with families, they just want to work with kids. So they try that out. And then sometimes people want to work with adults with mental health disorders, but then there's a big flavor of substance use disorders. So sometimes it's very important to try what you want, try the area that you're interested in to see if it's the right fit for you. HUS 470 is field placement 2, and it's 336 total hours. It's 24 hours a week. Again, it can be divided the way you and your field placement decide to do it. Some students like doing 4 6 hours. Some people like doing 3 8s. Some people have actually chose to do a weekend shift. Like they might do 2 8-hour days during the week and do a weekend just to get a different flavor of how things work in that organization. But this is an opportunity to really establish relationships with people. And you get to also focus more heavily on the population, maybe a particular age group, and to advance your skills, because you're going to be really sitting in this agency for 24 hours with an hour's worth of supervision a week. So let me just cover that area. In both placements, you need to have supervision 1 hour a week with a bachelor's level supervisor. In that person, that supervisor has to have a bachelor's degree in a related field, like psychology, could be criminal justice, could be education. If you have any questions, you can ask John or I or Wendy about what fits into that. And I think I'm ready for the next slide.
And it looks like it's me. Okay, so let's talk about credit for prior learning. And credit for prior learning, and we call it CPL, is a process by which students can earn college credit for the college level learning from work and life experience that's gained outside of the traditional classroom. And UMA offers several different options to earn credit, such as standardized exams, such as CLEP exams and credential reviews. So for example, if you have your full BHP certification, if you can send me your certificate, I can post HUS 354 credit for you in Main Street. However, the most common pathway to earn college credit in mental health and human services for credit for prior learning is through the portfolio review. And I coordinate the portfolio review process, so you can definitely use me as a contact person. For many of you, you may already have experience working in the mental health field, and this may include working in case management, working as a DSP, serving as a foster parent, parent education, one work. I've seen a lot of different things. And if you're not sure about whether your experience would qualify, please feel free to reach out to me or to Kim or to Wendy or John, and any one of us can try to connect the dots for you. And through the portfolio assessment process, you have the opportunity to write about how you've met the course objectives through your work experience and your training, and include evidence that proves that you have both the practical and the theoretical knowledge behind what you're doing. We know that you understand the practical aspect of your experience, but we want you to tell us the why and the how of your knowledge and experience. For example, discussing the importance of establishing boundaries and maintaining confidentiality. Or perhaps there are specific approaches that you use with your clients. How do these approaches contribute to the well-being and the support of your client? Things like that. The most common portfolio that I see is for HUS 270, which is obviously the first field placement course. For this particular portfolio, you have to have a minimum of 6 months of experience and training in order to qualify for this. There are other classes that you can submit portfolios for, but for those courses, you have to have at least a couple of years of experience to qualify. In terms of the platform, UMA uses Google Sites as this platform. And as I've told many students, it's really easy to use once you get the hang of it. It can seem kind of scary when you first start, but I'm there every step of the way to help you get through it. So here are some of the requirements or the required components for the portfolio. You'll need a copy of your resume. You'll need a personal narrative, which is basically a short autobiography of what led to your interest in working in the field and what your professional goals are. The knowledge and competencies section, this is going to be where the bulk of your writing is going to happen. And this is where you're going to be addressing, again, the specific course objectives and writing about how you've met them through your work experience and training, and discussing the importance of what you've learned. Another question to think about too is how can you apply what you've learned to other areas within mental health? I've also had students who have included case studies in their writing, obviously redacting any identifying information, but it could be a good way to prove that you know the what and the how and the why of what you're doing. So the next section would include job descriptions and evaluations, mostly to verify the work experience. We would like to see at least one of each. And then the next section is letters of recommendation or verification. We typically require 3 letters, ideally from current or previous supervisors. We understand that not all agencies are able to provide letters of recommendation, so we will accept letters of verification from human resources if needed. And then the last section is really just a catch-all. It's the supporting documentation section. And this is where you're going to want to include evidence of things like your trainings, so training certificates or agendas, certifications such as the MERT-C, BHP, DSP, CRMA, really any of those certifications. And if you're a member of any professional organizations, that would be great to include as well. In some of the information that is on the portfolio site, which is on the slide actually, some of it will say, you can include things like training manuals that you've written, or if you've been an instructor for a course. If you haven't had those experiences, don't worry about it. These are just really ideas for things that you could use to prove that you have met the course objectives. So yeah, so this is the portfolio overview site. Link is on the slide, just so that you can kind of learn more. And if you're interested in talking more about it, feel free to email me at hbrown120@maine.edu, and I'd be happy to get you going. So I think the next one is going to be John.
Yeah. Hey, thanks, Haley. And thank you, Kim, for the overview of the placement classes. We're going to just take a look at the classes again, the placement 1 and 2, in terms of like what it really takes to get enrolled in them. And you can see here on the left side for HUS 270, but first of all, it's a 3-credit class, and the prerequisites are having 45 or more credits earned in the program, and then completion of that fieldwork preparation class with a grade of C or higher. Okay. And Kim mentioned the side hours, so I won't get into that in entry level. And again, well, just that you must pass the class with a C or higher. And then on the HUS 470, that's a 9-credit class. So to be in this class, you have to be a senior in the program. So that's 90 or more credits earned in the mental health and human services program. As you can see here, there's some additional prerequisites, not only the 223 with a C or higher, but you have to have the credit for 270 posted, whether by taking the class or by the portfolio process that Haley just outlined. Also, HUS 308 assessment and planning, 316 applied professional ethics, and 349 supervision in the human services. And again, Kim mentioned the side hours, 336, and you can spread those around. And note this at the bottom, that both classes, sometimes I get this from students, there's a little confusion. They're focusing so much effort on getting their paperwork ready for a placement and talking to their site supervisors. Sometimes it gets lost a little bit in the process that, yep, you've got a class you're registering for, like all your other classes, and that means you're going to have a Brightspace online class component. So you're going to be going into your Brightspace class, and then you're going to be doing your side hours. Just want to mention that. And the reason why 470 Field Placement 2 is 9-credit class is because we're, as an institution, we're requiring you to put 336 hours of your time and energy out there in the community. So that's why it bumps out to a total of 9 credits. Your online Brightspace class experience is going to feel more like a 3-credit class experience where you're having seminar meetings, posting things, check-ins, this and that. So I don't want you to feel overwhelmed that there's this 9-credit Brightspace piece. It's actually kind of like a 3-credit class experience there, but all of these extra hours that you're putting it out in the community. Yeah, next slide, I think.
Excuse me, John, do you mind if I just add something to you? 'Cause I think so yes, I forgot to mention 270 and 470 have classes along with it, which includes a seminar. So we meet with students, and when you sign up for the class,
Uh-oh, came out of Lester.
Yeah. It's cold on the coast.
It is. All right. I'm trying to think. Okay. All right. Well,
Yep.
she'll be back in a second.
Yeah,
thanks, John, sorry.
it's okay.
So
Are
you
you
kind of
all set?
went like you ended mid-sentence, so we weren't quite sure.
I just want to make sure people understand that when they sign up for the course, that they sign up, they know when the seminar is so they can attend it.
Okay. Yep. Yeah. And that would probably be listed in the Brightspace course area, like when those meetings or the seminar meetings will take place.
Right, like for example, I do 270s. I do the 270s and the 470s on Sunday evenings. One is the first Sunday of the month, the 470 is the second Sunday. But Diane and Lauren do it at times during the week.
Okay. Yeah. Nice. Yeah. And so to be able to actually take one of these field placement classes and to do your field placement, there's this item, the placement information form, that we use the term PIF for. And this is a single page form with some information you have to fill in, and you have to get it to me or to Kim a long time. Look at that, 2 months before the start of your semester placement class. So that's sort of a little bit of a strange ask in the world of higher ed, in my opinion, that like your class is going to take place, you know, in late August for the fall or early September, but you have to have the paperwork in this example, July 1 for fall classes, this third bullet item. So I just want everyone to be aware of that. And you're probably going to become aware of that because I end up emailing you. Probably some of you have seen some emails from me, but we send you so many emails about that because of that strange nature of, look, you've got to get this form in long before the placement class takes place. And the actual reason for that is we take the information from that form and we build out an affiliation agreement with the site. And then this is all what I'm talking about now is kind of behind the scenes, but there are these processes that go on where we connect with the site connects with us, some paperwork is exchanged, and it sets your placement up. And we need those 8 weeks, about 2 months, to get all of those processes completed so that you're really ready to go and that you'll be comfortable starting on time. So you see these deadlines: July 1 for fall classes, November 1 for spring, and March 1 for summer. So if you are thinking of doing this coming summer, you know, we just have a couple of weeks to get that PIF to me or Kim. And this in large print down here, if you do miss this PIF deadline, you're not going to be able to take that field placement experience in that upcoming semester. You'd have to push it out to the next semester. So it's super critical that this PIF information gets to us. And we definitely want to help you get it done on time. So that's why we're kind of, maybe some people feel over communicating, but we're really communicating about that all the time with students. So that's what that's about, the PIF form. And then down here, there's a link, and so the PIF form itself and a bunch of other resources are available to you 24/7 from the UMA portal page. If you log into the UMA portal page, go to that academic program drop-down menu that Haley's on, go to mental health and human services. A lot of folks don't know this is here, but this is a page that the Mental Health and Human Services program built for students in the program to get all sorts of helpful resources to help them through field placement processes, lots of processes. So there's this giant green button that Haley's about to click on, field placement resources. Thank you, Haley. And there's a giant box on the right there for HUS 270, and below that HUS 470. There are sample documents. But if we get to the bottom left, and then we're all, yep, there it is. There's your PIF form. There's a little instruction docs on how to fill it out. Liaison team, so you can get a hold of us if you have questions about any of the field placement information. There's even a document there called previously approved field placement site examples that have links to all, like over 60 different places in Maine, I think, are listed on there. So you can begin to explore, right, sites that might be of interest to you, or the kinds of sites that might be interest of you. So I definitely wanted to just share with you, if you go to the UMA portal page and then drop down academic programs and get to this field placement resources page, this is just here for you anytime you'd like to be able to get the documents and the information you need. Thanks, Haley. Yeah, we can go to the next slide. So this is a question that we get a lot about being paid or unpaid. If your status for your placement hours, right? And so the 2 bullet points are really getting right to this. So if it's not through your employer, then it could be a paid or unpaid placement. And that's going to be a discussion between you and that site. UMA isn't really going to have a role in helping you decide. Well, I mean, we can give you some guidance about what your work-life balance and things like that, but we don't play a role in the process, I should say, in determining whether you're paid or unpaid. That's up to you and the site when you're discussing about doing a field placement. So if you want to get paid, by all means, ask, is there a paid internship or placement opportunity here? Some students walk into a site exploring the idea, and the employer says, well, we want to pay you. Are you okay if we pay you? So those are the conversations between you and the employer, the site, excuse me. Yeah. And if it does, whichever way it goes, you're going to notify us whether you are paid or unpaid. And the way you actually notify us is by that PIF form. So that form has a little checkoff box. Is this internship, this field placement going to be paid or unpaid? So all you really have to do is check off the appropriate box on that form, and you've done your part in letting us know. Okay. Yeah, we can go to the next slide. Yes, and then the current employer. So your current job. Can I use my current job to be the placement site and conduct my placement site hours? And then you may be able to use, but there's some needs to knows to get through. So the site has to be approved by the Mental Health and Human Services Department. You have to use your current position, held your current position. So if you've just started your job, let's say, and you've been there less than 6 months, by the time the semester of your placement begins, you can use that actual job you're in, that job description, that job for your placement site hours. However, if you've been with your employer more than 6 months and you want to use your employer as the site for your placement, that's a little bit different. Then you can't use your exact job responsibilities of your current job. You'd have to say to your employer, hey, I've got this field placement. Do you think I could carve out some placement site hours where I do a different set of responsibilities? And the idea there, of course, is that we want you to kind of reimagine what you're doing when it comes to site experiences rather than the job you've been in forever and just sort of bringing in course ideas into what you do now. We want it to be a richer palette. And the way to do that is to have you do a different set of responsibilities with bringing in the curriculum that you've learned from your classes. So yeah. And I think that's that.
Excellent, John. Thanks for doing that. Thanks for covering that.
Yeah.
Real quick before we move on to the next part of the presentation,
Thanks.
how
Kate.
does placement work? If you have a student who is incarcerated and they're trying to work their way through the mental health and human services degree?
So we've had I'll start this, but certainly, John, you can add. We've had students that are allowed to leave the facility to do some work. They've done some telehealth work to meet clients. We've had people doing recovery coaching in the institution. We have had all kinds of variations of that, but the person that's usually helps them is I think it's called the education coordinator. It's in the facility that kind of works with me. I've done a lot of video chats about some opportunities they can do within the facility if they can't leave it.
Fantastic, thank you.
John might have some other ideas.
No, that I think you hit everything I was going to hit, and you got to that last one about sometimes you can actually get the placement accomplished within the facility itself even. So yeah.
Any other questions, Katie?
That was a great question, by the way.
Nope, that's it for now.
Okay.
There wasn't a question, but Wendy had put in the chat talking about HUS 270 or 470. When you register for them, make sure to read the class description and the class notes in Main Street, because the class notes are where the information on when the live sessions are going to happen. And attendance of the live sessions are mandatory, but they're usually only every 4 weeks and not weekly like your other classes. So, great
Correct.
point.
Thank you. So at this point, I want to talk about, there are lots of job titles out there that are specific to settings, but they kind of are similar in nature of work. For instance, I have here case management. In the hospitals, it's often called a discharge planner, a person that helps with patients that are in the hospital to get discharged. That is a social work kind of function. Usually most of them are either RNs or social workers. The other position that's called case coordinators, where they kind of coordinate a client's care or a patient's care. Social workers, I got care coordinators. Care coordinators tend to be more on the medical side. Case management tends to be on the children's side or the, excuse me, or the mental health side. We have mental health workers, and that is usually a state worker that works with people in one of our state institutions or state hospitals, or in doing some of their, what they call transitioning into the communities. They're called mental health workers. But what I want you to know more about is not necessarily the title, but more about the functions. Because as you're looking for placements, and if you look for jobs in Indeed or in certain agencies, what you need to, when you look at the title, don't just stop at the title. Read the duties and responsibilities of the position, because that's going to tell you more of what kind of skills and knowledge you need. The same thing with recovery. There's different needs for different titles for recovery, because there's recovery coaching, which in some of it is certified recovery coaching. We have relapse prevention workers. We have outreach workers. A lot of outreach workers right now are working with people that are without house, they're unhoused, or they have mental health or substance use disorders in the community, but they're not connected with services. Advocates, we have there's advocates at children's services, adult services, teen services. Being an advocate is a very important role. We're using a lot of advocacy around legislative movement, which is really this legislation. There's a lot of bills there that are involving mental health and substance use disorder. Family support specialists. These are positions that support a family and support a child that's in the family. Navigators are often called now. This has been a new, probably in the last 3 years, they're called housing navigators. These are people that are helping unhoused people find housing and get through the housing stipend issue. And then we have direct support workers, which can be often be working with adults. And we have family visitors. But another position out there is supervisor of supervised child visits. So parents that have to have their visits supervised. A lot of people are starting in the field and starting in human services are learning how to supervise child visits with the bio family, or whoever that adult is that wants the child in their home. So there's all kinds of, I guess what I want you to know is there's all kinds of room in this mental health and human services field, which is exciting. It has all kinds of places you can go with it. But when you start looking and you start talking to people, please look at the duties and the population you'll be working with. I guess I'm ready for the next slide. Thank you. Is that?
Yeah, I can cover it and feel free to jump into that. What you said, Kim, there's so many different areas that you could work with in mental health. It's so exciting. These are just some ideas for potential career avenues, such as administration and management. Obviously social work administrators are proactive leaders in public and private agencies that provide services to clients. So you could work in, heading up a nonprofit, or you could work in healthcare management. A lot of these positions require knowledge about social policy and the delivery of social services, having a vision for future planning and an understanding of human behavior, and commitment to social work ethics and values. You could also work in advocacy and community organizing. Historically, community organizing and social work were responses to many of the forces that created inequity in our society. And so a lot of these are remaining necessary and effective as ever today. Social work advocates champion the rights of individuals and communities with the goal of achieving social justice. So, working with the power of numbers, having many people think, work, and act together to, counterbalance powerful groups and the means that they have to protect and extend themselves. You could also work with the aging population, making sure that they can live independently and with dignity, and maximizing their quality of life and participation in society. Usually these folks, focus on the physical, psychological, social, and economic sorts of aspects of daily living. Child welfare, let's try that again, Haley. Child welfare, social workers serve some of the most vulnerable children, youth, and families. They're basically there to intervene to protect children from harm, whether they need to remove a child from the home or if they need to get them to a better environment, and working with children who, have not had great lives, and helping them connect to a range of services. Working with social workers can also help parents of children with developmental disabilities understand their legal rights, and helping them learn how to be advocates for themselves, so that their children can be as independent as possible. Working in healthcare, we've kind of talked about this a little bit, but basically, working in settings such as planning, administration, policy, or they could be helping people, the care coordinators and the case coordinators, and helping patients get the care that they need in order to be successful on their own. International social work. So this could be working in refugee camps, orphanages, hospitals, schools, supporting the efforts of national governments. Lots of different types of work there. Another common organization that they might work with could be Doctors Without Borders. It'd be kind of a neat sort of program. Justice and corrections. So social workers who are working in justice and corrections could be found in courts, rape crisis centers, police departments, correctional facilities. They are working with incarcerated residents to improve their lives, or to work on making themselves better, for if they're released. And mental health and clinical social work. Obviously, this is the most common. It's the largest group of providers of mental health services. They provide services in both urban and rural settings, where they could be the only licensed provider of mental health services available. Especially in Maine, it can be tough to find, especially way up north. They're far and few between. Mental health and substance use social work. These folks help individuals, families, and communities find ways to recover from substance use disorders. Social workers who are trained in treating alcohol, tobacco, and other drug addictions can also be found doing case management, group and individual therapy, family counseling, advocacy for jobs and housing needs. Kim talked about that earlier. Community resource development, that's a huge piece to social work, and policymaking. And just very quickly, the rest of them, some social workers may work within organizations to help them reimagine their structure and methods to improve their morale of their employees, productivity, creativity. They could provide job counseling if they work for a union. Policy and planning, working with the legislature to try to, come up with policies and statutes that will help the community, study the needs and related issues of people, conducting research, and suggesting alternative approaches to new programs. Politics, you can go into politics for that, whether it's, being on the school board or going to the city or county governments, or even to the state legislature or beyond. Public welfare, research, school social work, working from the school perspective and making sure that children are getting the emotional, developmental, and educational support that they need to be able to thrive in their community and in their school. Okay, that's it for me. I'm going to go to the next slide, and I think it's Kim.
It is. But I want to start, as I talk about the top main employers, but I want you to realize that you guys have connections with people about finding out, when you go looking for placements or for jobs in this field, use your faculty, use your center directors. I was talking to Sally. Sally and I have been around for a few years. Sally is very connected in her community in Ellsworth. So talk to your faculty, talk to Haley, talk to John, talk to other students who are working in the field. They are connections for you. I have students that have a hard time making cold calls to, say, Maine General Health. So if you talk to a student, they may be able to give you a name, so it's not necessarily a cold call, or they may be able to open a door for you. So I just want to encourage you to use your resources to help you look for placements and employment. So Maine has several top employers in mental health and human services. As you can see, the state of Maine is one of the leading. It has over 3,000 employees throughout the state. And actually at one time it had 6, not sure where they are today, but they have an array of services for you, whether it's mental health, substance use disorder, developmental disorders, cognitive, intellectual disorders, all kinds of services within the State Department. Most of those positions require you to have a bachelor's degree and to get your social work license. They have an eligibility specialist, people that work with families. So there's all kinds of things to start looking. They do put their job, you can look at maine.gov for all their jobs listed, or you can go Indeed. They post things in Indeed. Maine Health is a very big operation. It started with the hospital, but it's way more than the hospital. They provide community services all over the state of Maine, mostly south of Augusta, but they do have services in Rockland and in Farmington. So it's east and west. But you can look at the Maine Health website, and they have all kinds of positions listed. Acadia or Northern Light Help. They are again a big kind of conglomerate of healthcare services, whether it's inpatient or outpatient services, community-based services. Maine General Health, which is located more in the central Maine area, but they also have a component as part of Health Reach, which is another part of them that runs all the rural health centers. And a lot of PCPs, a lot of your primary care physicians' offices now have social workers in those offices to help patients with case coordinating, setting up with services, setting up with Maine Care or some Medicare, any kind of health insurance. So they have social workers in there helping them do that. So Maine General Health has a hospital, has community-based services, and also has a behavioral health unit or baby health services, a wing to that. Catholic Charities of Maine has been doing a lot of work for years around refugee and services for the elderly, but also mental health and substance use. And their main office is in Portland, but they have offices all the way up to Bangor. Pathways of Maine is another big organization that works with families and children and often goes into homes. Woodford's is a family services program. They work with children and they work with families. So a lot of things to consider when you're looking for work is salary, what's your drive time like, things like that. What health benefits, what employee benefits you're going to get. So there's some data out there. Salaries really range throughout the state of Maine. You can get a different income from Kittery on up to probably Brunswick. And then from Brunswick to Pittsfield is another salary. And then further north is another salary. As you go up the interstate, it seems to be the cost of living changes. As you know, probably right now, well, I know right now in Portland, a 1-bedroom apartment is about two grand. So you can't have the same salary in Portland as that you might have in Madawaska. So you want to be thinking about that, but the average salary right now in 21 is about $18 to $22 an hour. I will say, and there's several bills in front of the legislature right now to increase the base salary for people doing direct services to clients. I would say, you know, after 3 or 4 years, you'd be looking at about $26 to $30 an hour, which is about an average once you've been in an organization 3 to 5 years. But don't forget, on top of your salary, most employers pay benefits. Rather it's I say PTO, it's called a paid time off. You want to be very aware of paid time off. This field is not something that you can do without having some vacation time or time to yourself. So be aware of paid time off, or some people call it earned benefit time. So you want to know how much vacation time or sick time that you get, or holiday time, and how that's rolled together. You want to look at health insurance. Do they offer health insurance? Do you need health insurance? And if you don't need it, are you giving that money back? Dental, you want to look at life insurance. You want to look at mileage reimbursement. Do you have to use your own car? These are all things to consider when you're interviewing for a job. It's because all of that will add into a salary. Next slide, please. So career progression. So it's very, I think it's important to, wherever you land, whichever place you decide to work, is to be looking at opportunities that you can advance in, but so also to be aware that not to advance too quickly. You have an ethical responsibility to work within your areas of competency. Where are your strengths? Where are your challenges? Is your supervisor able to help you grow with those? But don't take a job that you might be way too far over your head. It's better to make sure you have supports built in as you advance your career. Let's see, boundaries. There are a lot of open positions right now, and I will tell you, and John and I's experience is that sometimes we get calls from our students that are in field placements, and 2 weeks into it, they're offered a job. And can I do it, Kim? And of course you can, but let's think about the difference between being a student and being an employee. And being a student is you're allowed to make mistakes. You don't have usually the same productivity or the same amount of people to see in a day. You're allowed to have more coaching, but when you become an employee, there's an expectation of how many people you see in a day, or how quick you can get your notes in, because that equals the organization to be able to bill. So you want to be very careful if you move from intern to employee, and the things to consider in that. Does anyone else want to add anything to that? Because I know, Haley, you and I talked about it a little bit.
I think what you have is great.
Okay.
I don't know if Wendy has anything, or John.
I will add one thing, and it had to do with the previous slide. Well, about benefits. Kim was talking about thinking about the benefits in the equation. And one of the benefits could very well be professional development benefits. Right. So a lot of mental health organizations, they want you to grow and develop your skills, and they sometimes will assist with paying for higher education, for example, or your next level license, for example, or exam fees, or so I just wanted to toss that in.
Perfect, John. Thank you. Because again, that's one of those things that doesn't get added into the compensation package.
Yeah.
Wish it would. I guess we could jump to the career ladder. So this is a general career ladder that I've adapted from a few different sources to kind of give you an idea of where you could start and work your way up to over the course of your careers. And of course, with my career counselor hat on, it's very important to note that no career is ever this linear. Wouldn't it be nice? It's just not the case. So what I've done is on the left-hand side under the direct practice, I've kind of combined a lot of the common sort of positions that you could start with. So, maybe starting in case management or working as a DSP or a community or CSW, a BHP, et cetera. And then you could move up to, you'd move up to be getting your bachelor's degree and then applying to become a social worker and getting your LSW. From there, you could go on to your master's and getting your clinical social worker license and doing private practice or opening up a nonprofit, things like that. But you could also go down to, you could even work as a policy officer. I know that there were a couple of students who were kind of interested in more of the policy side of things. So that could be a good way because you'd have the educational background behind you in mental health. And especially if you've worked for a while in social work, you have a better understanding of what the issues are. And you can kind of help legislate some of those, those changes. These 4 groups, just to make it simple, there are obviously many different kind of areas that you can go into, but the most common would be direct practice, management. So if you're heading up a nonprofit or anything of that nature, or even working in hospitals and healthcare, you could be the director of, care coordination or things like that. Policy and legislation, and then research and evaluation. That's also another interesting sort of area that I don't think a lot of people think about. Because a lot of what is done is because of research, whether it's in psychology or in social work, the best practices all come from research. And so if you want to have an impact on how things are done, and you don't want to necessarily go into policy and legislation, research and evaluation could also be a good avenue for you to go into. So there's some ideas to give you an idea of where you could go. And, as was mentioned by Kim earlier in the presentation, not every job is going to be listed the same way in online or, so it's just important for you to read between the lines about when you're looking at the responsibilities of the role to see how close it would be to some of these jobs. I would personally recommend using ONET, which is the U.S. Department of Labor's Encyclopedia of Occupations. There is a ton of helpful information there, especially when it comes to how jobs are named and the wide ranges of related careers out there. So if you're interested in that, I put the link right on the slide. So definitely check it out. Any questions on the career ladder? Like I said, I've adapted it from a few different areas. So yeah. Okay, I guess we'll skip to the next one. So this is my career services sort of hat here. So when you're looking for your field placement or your internship site, it's going to be important for you to have a set of strategies or a toolbox, because an internship search is going to be identical to a job search. There are specific things that you're going to need in that toolbox in order to conduct a successful search. So the first thing you're going to want to do is have a focus. Where is it that you want to work? What are your values? What's important to you in finding a job? Is it going to be compensation? Is it going to be who you're working with, how you're able to do your work? Are you going to be around people a lot? Are you mostly going to want to be around a computer? Those are different types of things that you want to do. Your personality type, because not every agency is going to operate the same way. So making sure that you have a personality that could fit into the work that you want to do. And what your skills and your strengths are. What do you bring to the table? because when you're creating things like your resume, your cover letter, and when you're interviewing, you're going to need to have a good sense of all of these things to be able to advocate for yourself and to show that you are the best candidate for this particular internship. Now your resume, again, it's basically going to be an ad of yourself on paper. So you're going to want to put the most important information on there so that they might invite you for an interview. And then a cover letter, if it's required, sometimes they're required and sometimes they're not. It's really a great opportunity for you to have your personality come out and to really explain why the experiences that you've had in the past really have prepared you for the potential internship placement. And I always say interviewing skills is the big one because it could be a source of stress for a lot of people. I know it is for me. But I will say that we do have an online platform called Big Interview. And it's an online, it's part interviewing curriculum and part mock interview. So there are a ton of videos that you can watch to improve your skills. You know, they videos on how to answer questions like, what are my greatest strengths? What are my greatest weaknesses? They have salary negotiation videos. They have, you know, really anything under the sun they have under this this place. And then on the mock interview side, you can actually practice your interviewing skills by recording yourself answering questions. And you can send out your videos to people for feedback. So for example, if you'd like me to take a look at how you answered the question, I just had a question and it ran out of my head. So tell me about a time where you had to use your problem solving skills. You would send me that question and then I would have a scale of 1 to 5 stars on a variety of different things, such as how clear was your answer? Did you use a lot of ums and ahs in your answer? How was your attire for the, or, you know, were you dressed professionally? Is what I'm trying to say. You know, things like that. And something for faculty to know is that I do have the option of creating assignments. So it could be something that you may want to consider building into HUS 223, to be honest, or as part of the internship anyway. It's in the UMA portal, and it's a black sunshine. I forgot to put the link here, but it's basically a white square in your launch pad with a sunshine on it, in black font. So check it out. If you'd like more information, just let me know, and I'm more than happy to walk you through it. Okay, so let's talk about networking real quick here. Networking has become more important than ever before in the job and internship search. It's really become a who you know situation, and cultivating and sustaining your network is an ongoing process, even when you're not specifically looking for a job. Start thinking about who you might already know, and that can include family, professors, staff, employers, and friends. And then consider affiliations that can expand your network, such as volunteer opportunities, professional associations, sports, meetup groups, or spiritual organizations. You know, getting connected often means getting involved. So attending events, workshops, and activities that can get you out of the community and talking with people. And I think you'll be amazed at how many connections you might actually make by getting out of the community. Doing your research and using your sleuthing skills will not only help you unearth internship and job possibilities, it's also going to help you prepare for an interview at the same time. So what organizations and positions, locations appeal to you and match your criteria? So there are a lot of different websites that you can use for that. I would definitely recommend LinkedIn as a good start. But you could definitely look at company web pages and things like that. In the process of your research, you can decide whether or not an organization is right for you or not. And you can include some of the complementary findings in a cover letter or in an interview. So the internet can be a great thing. Use it to your advantage to prepare yourself for your next step in your professional journey. So the last link that I have here is on the Career Connections website. So I have a whole website curated with a lot of job and internship strategies, how to write a resume, how to write a cover letter, and more information on interviewing. And then the last slide that I have before we go to questions, final questions, is just a diagram to get you thinking about who you might know in your network and maybe some people that you might not have thought about. So you're in the middle, but you have all of the direct contacts in blue. So you have your professors, you have your UMA friends, you have friends outside of UMA, professional contacts, your family, and then you have like the second degree contacts. So really, people that they know, their colleagues or their professional contacts, their family, their colleagues. So the world's your oyster in terms of getting connected to people. And you just never know who might have that connection. It may not even be somebody who's connected in mental health. It could be somebody that knows somebody who is working in that field. So definitely get involved because you just never know who you're going to meet and who either you might be able to help or they might be able to help you with. So, okay. All right. So I'm going to stop sharing my screen here for a minute and see if we have any lasting questions.
Now's the time to drop anything that you might want to ask in the chat. I'm going to lead with a question that was asked via email. Associate's degrees do not seem to be acknowledged in the profession. In the field, what is the difference between someone with an associate's in mental health and human services and someone without any degree?
Thanks for that question, Katie. I know I had seen this question when it came in via email and found just some statistics to help students just appreciate the value of an associate's degree. So, for example, if you have an associate's degree, your rate of unemployment is less than those who only have some schooling or don't have an associate's degree at all. Also the MHRTC certification, as well as the Certified Alcohol and Drug Counselor licensing process, both recognize the associate's degree as an approved credential to pursue those certifications. And just the other piece is, I think it's always helpful to think about one's median annual earnings. So when you picture yourself, okay, when I graduate, if I don't go to college at all, if I only have some college, if I have an associate's degree, or if I have a bachelor's degree. So the data from 2020 says that if you have an associate's degree, the median, the middle annual earnings for individuals was about $44,000 a year. That is $15,000 less than someone who had a bachelor's degree, but over $4,000 higher than workers who had some college but no degree, and over $7,000 higher than workers who only had a high school diploma. So the overall, your lifetime earnings, if you have an associate's degree versus not, definitely accumulates over time. The last piece I'll say is when I put on my supervisor hat and said, okay, if I was a supervisor of a program and I got two resumes and one had their MHRTC and some college and someone had their MHRTC and an associate's degree, which one do you think I might interview first? And I'll sort of leave it at that because it's showing your ability to commit, to follow through with something, and that you will have learned some skills and experience through pursuing that associate.
Fantastic. Thank you for that response. I'm going to take one from the chat and then I've got two more from the email. So from the chat section, we had a student who is still pursuing their education through UMA, but they've relocated out of state and live in Virginia. Are we able to help them in finding an internship?
Well, I'll answer that and John can probably help me. It's interesting. We have an international student, and where is that student, John, this semester?
Yeah, I think it's Thailand, I think.
So if a student wants to get an internship, first of all, UMA doesn't set them up. It's up for the student to find their own field placement. But we can help you. Like, we have had students in Virginia before. We've got a student right now in Florida. So we do have students all over the country and internationally, but it really is, we are trying to help you set up your own placement because it's your profession. It's what you want to seek.
Yeah, we've most recently had a mental health and human services student in Virginia who did their placement with, I can't remember the name of the county, maybe Fenton County, but it was some name of county services. And so it was a kind of like in Maine, we have, I think, our Department of Health and Human Services. I kind of felt like it was something along those lines within
Yes,
their
John.
state government.
Yeah, it was. I think they did. We do services by region. They do services by county down there. So absolutely, that's what it was.
Fantastic. Thank you both for that. Moving into two questions. I'm sure there's going to be some overlap between them, but I'll start with the first. What are some personal or public information that employers might disqualify you for? For example, if you had an arrest record, or if somebody looked you up, and just kind of Googled you and maybe found you attached to like a lawsuit, or if there are just general news articles out there on you, or monitoring your social media, that kind of a thing. What are those things that can kind of disqualify you, and what should students be paying attention to as they're trying to present themselves in the best light manner to employers hiring them?
I think the first thing I can say is that most human services jobs, I can't say all of them, but most of them require a background check. And you will have a background check that is both state and federal. Some require a motor vehicle check. Those will come back. So you have to be honest. Part of the thing is the length of time, the type of conviction. So regarding background checks, it is an individual thing. And there is a DHS thing. So if you've ever had your children taken away or had a substantiated finding, all of that plays into that. Some of the other things, Katie, you were saying about social media, right now, I'm talking about in 223, we talk about you have to know what you've put out there in social media that can be tracked down, because now's the time to clean it up. And you want to be very careful what you put out there and how you put it out there. So I will say that some agencies are more lenient with that than others. Some are going to ask you. You hear all kinds of things now about people have put some things on their social media regarding, I will say, stereotypes or stigma attached to diversity. You have to, again, you have to Google yourself and see what's out there for yourself.
A good rule of thumb, I was going to say, a good rule of thumb is if you don't want your grandmother to see it, don't put it on social media.
Fantastic. We did have somebody who joined a few minutes after, and so I think missed a little bit of the internship information. So the question is, where do we start to access internships? And I'm sure we're going back to the HUS kind of prep courses. But I think in general, where do they start thinking about accessing internships? And then who do they contact if they need guidance in finding internships?
John and I have been happy to do that. We have helped many students sort of at least start, like, some places that we currently have affiliation agreements with. We start with that. We have, UMA has been around for a long time. A lot of our students work for employers out there, so their connections. But I'll defer to John on that. But we can help you find places, but we're not going to knock on the door.
Yeah, I think a great place to start is on that mental health and human services portal page in the field placement resources area, there's the previously used sites with a document with over 60 different placement sites that have been successfully used with links to every one of those organizations. So it's a great way, and it's grouped by town, region, state, so it's really a great resource to kind of get yourself thinking. You might just find the site that you want to use, or it can get you going with some ideas of what you want to look into. That list of 60 something sites is by no means comprehensive. It's a list of examples, but there's so many more out there. But if you see an agency or an organization or a nonprofit in that list of 60 different sites that are linked, and you see some kind of services taking place in a community, then it's a great starting point to look around in your own community, see if you can identify something similar to that that's within driving distance, easy for you to access. And then, if you want to run that by me or Kim, happy to discuss some of the places you found. And then it would be you reaching out to them and getting the ball rolling. But we're definitely very eager and happy to assist.
I would also say another resource is 211, which is run by United Way.
Fantastic. If anybody else has any outstanding questions, please feel free to put them in the chat. The last two questions that I have that were sent in by email are less related to specific jobs or specific careers. They're more related to types of degrees that you can earn. And then a separate question that's about kind of mental health issues that are related to substance use disorders. So I'm just going to pause for 1 second before we kind of move away from the jobs and kind of networking and internship questions. I want to give you all a minute to chat anything else that you have related to that before I take us in a different direction with these last couple questions that were emailed in. So I'm just going to hang out and see if anybody drops any last things regarding jobs and placement in the chat. Okay. I have my PIF filled out for this summer and turned in for Living Innovations. Since it's for HUS 270, they want to start my training now since there isn't a lot of time. They feel like if I did just the 8 hours a week, I would only get the training done and not get any real experience with the population. What is the legality of that with the college? This is only for an internship, not a job.
So we do have an affiliation agreement with Living Innovations. But if you start now, your hours might be filled before the summer gets here, and you still have to do 112. So, that is up to you in terms of orientation. I understand what they're saying, because by the time they onboard you, your 112 hours of the summer would be over. So really, Meryl, it's going to be up to you how you want to do that. Do you want to volunteer and attend these onboarding trainings? It does happen. I will tell you, it also happens in intimate partner violence programs that you have to attend the training before they allow you to be an intern with them.
Great question. Any others for folks in the chat regarding job placements or kind of career potential opportunities or placement? Going once, going twice, just kidding, it's not all the way gone. But I'm going to move on to the last couple of questions. So we did get a question, and it's just a very broad question about how mental health issues relate to substance use disorders. I'll just preface that answer as, you all want to say that this is entire courses that kind of encompass answering that question. So I will let you move ahead with answering it as you all kind of see fit on the mental health and human services faculty side of things. And if the person who answered that question is here now and you had something more specific, please feel free to chat me directly and I can, kind of answer it or get some more specifics in there. But generally the question was, how do mental health issues relate to substance use disorders?
I'll speak from my clinical hat and anyone else can join, but from my clinical hat, there is a great correlation between mental health and substance use disorder. It is more and more a requirement to work in this field to understand, have competencies in both areas. We have a student here that's in our graduate certificate program, and I think she can speak to that as well, but we're finding that there's a close connection between substance use disorder, mental health, and trauma.
Great. And then the last question I got via email was kind of related to the previous session that we had, so I've saved it for last. What's the average time frame to earn an associate's in mental health and human services with the MHHS, the SART, and the CADC?
You want me to try that one, Kim? Okay. So the associate's degree is 61 credits. So depending how many credits you take a semester and whether or not you take classes year round, including in the summer, will impact how long or short it takes you to get that. A full-time student, if we were using a traditional student model where the student is focused only on school and not juggling 20 other things like many of our students do, you would have 5 classes a semester. So an associate's degree would be 5 in the fall, 5 in the spring, 5 in the fall, 5 in the spring, and within 2 years, you would have your associates in hand. But we know the majority of our students do not take that many classes or pick up some of those classes in the summer to offset lighter loads in the fall and spring. So it really is up to the student how many classes they take, and from there, how long it's going to take them to complete their degree. The associate's degree does allow someone to apply for their CADC license. It also allows someone to apply for their MHRTC certification. You will most likely in the associate's pathway not have all of the MHRTC courses done. So you would receive a provisional type certification or a 1-year certification while you completed some of the other learning domains you would need to finish. Because not all the required classes for the MHRTC are embedded in the associate's degree curriculum. I think. And we didn't even talk about the SART. The SART, the Substance Abuse Rehabilitation Technician Certificate, is a completely different set of classes. There's only a couple of classes that overlap with the associates. If someone wanted to do all of those classes, the MHRTC, the SART, the associate's degree, you're pretty close to your bachelor's degree by that point.
Fantastic. Thank you for that information. We had one comment in the chat, kind of going back to the mental health and substance use, and that was that in their current facility, sadly, the students don't receive the incarcerated population doesn't receive adequate treatment there, and so often upon release, they end up going back into the system rather quickly because they aren't adequately supported. So thank you for sharing that to that student. We appreciate hearing your voice.
I also will add to that, what you're finding right now is that a lot of organizations are looking for staff. there are more vacancies out there right now than there are people looking for work. So until we get our staffing up, a lot of services are falling short. And that's what UMA is here to do, to help you enter that career path.
And like Haley said, this is also why we want to stress the importance of building your network. Because you now get to be the person helping and holding up other people and supporting them in their recovery. And any other avenue as well. All right, that's all the comments and questions I see so far in the chat. So if there are any other last minute ones, we're just gonna pause here for about a full minute. And then we will say our goodbyes after that, if no one drops their any more questions or comments in.
And what I can do is I can share the last slide, which has all the contact information for the folks who presented tonight too. So if you folks are interested.
Oh,
Do not.
I was
Okay.
talking that entire time and thought I had unmuted myself, my bad. If anybody needs to pull out their phone and take a picture or a screen grab of this, please feel free to do so, so you can reach out to us as needed. We will also be emailing the recording of this presentation around to all registered attendees. So if you're unable to kind of access a phone right now at this point, you will have access to this information after the fact. And then I'd just like to give a special shout out and thank you to Haley, to John, to Kim, and to Wendy for volunteering their time. And thank you all to our amazing UMA students who kind of are making the world a better place, especially through this type of work. Thank you for attending this evening.
I want to thank everybody for coming, and please share this link that you'll have to the video if someone couldn't make it.